Good morning. My name is Suzanne Graves. I'm here as a concerned city resident and also to support the plant-based treaty team today. Thank you for the opportunity to speak and for all of your work and for the work of staff on the various food-related commitments, including the C40 Good Food Cities Pledge and, of course, the Cool Food Pledge. When I personally switched to a plant-based diet a few years ago, it was mostly for my own health as well as animal welfare. But after just a bit of research on the emission levels of animal agriculture, I quickly came to the conclusion that shifting to plant-based food sources isn't really a choice anymore. It's actually, I would argue, a global imperative. So I was excited to see that the report included a summary of the plant-based treaty that's currently gaining momentum globally. I fully support the direction of the report, but I would ask the committee to evaluate some of the assumptions in the report and urge you to go a little bit further than the recommendations in a couple of areas. Firstly, others have spoken also about the health benefits of plant-based diets. At page 7, the report talks about potential challenges of moving to a plant-based approach, and particularly where in the context of long-term care, like ensuring people get enough protein. The plant-based treaty team approached an expert, Dr. Zahra Kassam, about those dietary challenges. Dr. Kassam is the founder of Plant-Based Canada. She's a professor at the University of Toronto and the author of a textbook on plant-based medicine in clinical care. And she says that meeting protein requirements can actually very easily be done with a plant-based diet, with protein-rich foods like legumes, soy, various meat alternatives are available now, nuts and seeds. And there are, of course, calorie-dense plant-based foods that are a great option for those with reduced appetites, such as nut butters, tofu, avocado, and so on. And major dietetic organizations in the UK, US, and Canada, they all say that appropriately planned vegan and vegetarian diets are healthful, they're nutritionally adequate, and they can provide many health benefits in the prevention and treatment of some diseases. And there have been a number of studies to show that a plant-based approach can alleviate chronic conditions, particularly with older adults, and reducing medications. There was one study in the American Journal of Lifestyle Medicine of seniors in care homes that found that a vegan diet reduced the number of pills taken by seniors over 60 by 58%. So yes, there are challenges. But in your report to Council, I would invite you to reference many of the potential positive health impacts of a shift toward plant-based foods, particularly in older populations. And secondly, also at page 7, the report sets out a caution that plant-based recipes often aren't well received by residents of long-term care homes. And there's a concern that that could lead to lower food intake, potentially leading to negative clinical outcomes. And a couple of points on that. I noticed that the report doesn't specifically include an educational or awareness component. Maybe that's a given, I'm not sure, but I'm sure you will agree that change happens most easily when people understand the need for change. And education, an awareness campaign could also include residents outside the scope of city services, many of whom are struggling with food insecurity right now with rising food prices. And from my own experience, plant-based foods are much cheaper than animal foods. Educating people about the impacts of animal agriculture and showing them what a healthy plant-based plate looks like could not only help the environment, but also help to address food insecurity in the city. It doesn't need to be complicated. Perhaps the city could consider movie nights, talks, invite speakers to help promote the understanding of the need for change. There are some excellent movies referenced on the plant-based treaty document, in the plant-based treaty website, Forks Over Knives, Eating Our Way to Extinction, and so on. And there are some excellent speakers like Dr. Hassam, who might be an excellent speaker and a resource for an awareness campaign as well. I understand she's organized 5 plant-based conferences. And there are many materials at Plant-Based Treaty website and many other places. And I'll just also quickly mention the nudge strategies that have been used in other jurisdictions. I know New York City has used the greener by default
Final
approach
thought.
in hospitals. Thank you for your time.